The MacPro Help Desk team welcomes your suggestions for our training and reference materials. Please contact us with your feedback and comments on this training, or if you need other MacPro assistance. You may contact us via email at macpro_helpdesk@cms.hhs.gov or by phone at 301-547-4688.
My name is Christy Lau, and I'm an analyst at Mathematica. We'll walk through updates to the 3 core sets for FFY 2019 in these slides. First, for FFY 2019, no measures were added to the 2019 Child, Adult, or Health Home core sets. In addition, no measures were retired from the 2019 Child and Health Home core sets. One measure on the adult core set, antenatal steroids, PC03AD, was retired for FFY 2019. We'd also like to highlight changes to existing measures on the 3 core sets. The changes reflect updates by the measure stewards to measure specifications. On the adult core set, the FUA-FUM AD measure, follow-up after emergency department visit for mental illness or alcohol and other drug abuse or dependence, was separated into 2 measures for 2019. These 2 separate measures are follow-up after emergency department visit for alcohol and other drug abuse or dependence, FUA-AD, and follow-up after emergency department visit for a mental illness, FUM-AD. Additionally, on the health home core set, the nursing facility utilization measure has been renamed to admission to an institution from the community to reflect measure specification changes. We now like to highlight and describe measures with significant updates across the 3 core sets. These changes again reflect updates by measure stewards. Please note we held 2 technical assistance webinars in May that reviewed these updates in detail, and more information including links to the webinars, resource manuals, and summary of updates are available in Appendix A of the slides, which will be shared after the webinar. And for those familiar with the child and adult core set web pages on the Medicaid.gov site, you may notice that the pages have been updated. On the web page, you can navigate to these reporting resources through the State Reporting Resources and Technical Assistance link. And turning now to the updates, the first update is for the screening, depression, and follow-up plan measure on the child, adult, and health home core sets. The administrative method was added as a method for reporting, so the measure may be calculated using administrative data only. Validation via the medical record is not required to calculate and report this measure. In addition, in the guidance for reporting, the measure exclusions and exceptions were clarified. Next, for the measure controlling high blood pressure on the adult and health home core sets, the administrative method was added as a method of reporting in addition to the hybrid method. Further, the different thresholds by age and diagnosis were removed for the numerator calculation. Next, for the follow-up after hospitalization for mental illness measure, age ranges were updated for the child and adult core set measures. The FUHCH measure, age range was updated from beneficiaries ages 6 to 20 to beneficiaries ages 6 to 17, and the FUH-AD measure, age range was updated from beneficiaries age 21 and older to beneficiaries age 18 and older. For the HIV viral load suppression measure on the adult core set, e-measure specifications were added and are available at the link in the resource manual. Several updates were also made for the use of opioids at high dosage in persons without cancer measure on the adult core set. The measure is now expressed as a percentage, while in previous years it was reported as a rate per 1,000 beneficiaries. In addition, the numerator was changed to reflect beneficiaries in the eligible population with an average daily dosage greater than or equal to 90 morphine milligram equivalents over a period of 90 days or more, where previously it reflected beneficiaries with a daily dosage of 120 morphine milligram equivalents for 90 consecutive days or longer. Next, for the plan all-cause readmission measure on the adult and health home core sets, several changes were made. States report the count of expected 30-day readmissions rather than the expected readmissions rate. The expected readmissions rate is calculated by MacPro based on data elements states report. We also recently developed a fact sheet on the plan all-cause readmissions measure, and we'll send a communication soon on where to access this fact sheet on Medicaid.gov. Finally, as we noted earlier, for the 2019 Health Home Core Set, the nursing facility utilization measure was renamed to admission to an institution from the community. This measure had a number of other changes for FFY 2019 Health Home Core Set reporting. 3 rates, short, medium, and long-term admissions, are now reported instead of 2 rates. In addition, rates are reported for 4 age groups instead of 2 age groups. These age groups are ages 18 to 64, ages 65 to 75, ages 75 to 84, and age 85 and older. In addition, the definition of institutional facility now includes Medicaid-certified intermediate care facilities for individuals with intellectual disabilities, in addition to nursing facilities. Last, the definition of the numerator was revised and now only reflects those enrollee months during which the enrollee resided in the community for at least 1 day. For FFY 2019 reporting, we'd also like to note that exclusions for frailty and advanced illness were added to the following measures on the adult and health home core sets: breast cancer screening, the 2 measures of comprehensive diabetes care, hemoglobin A1C pore control greater than 9%, and hemoglobin A1C testing, and the controlling high blood pressure measure. Please note these exclusions were noted as optional in an earlier version of the FFY 2019 Resource Manual and Technical Specifications, but they should be treated as required exclusions. The Adult and Health Home Manuals posted on Medicaid.gov have been updated to reflect this, and the date on the manuals is August 2019. These are available in Appendix A of the slides. Now, I will pass it over to Emily to walk through the data quality.
My name is Emily Ho. I also work at Mathematica, and I'm going to continue our discussion on the adult, child, and health home core set measures. So first, we would like to provide a recap of the state data quality outreach process for FFY 2018. As many of you know, we conducted systematic data quality outreach using the Seek More Information, or SMI, function in MacPro. We would like to thank all the states that responded to our questions or provided important clarification and feedback. There are many reasons that we reach out to states during the data quality review process. On this slide, you'll see some of the more common topics raised in state outreach for 2018. For example, we typically ask states to clarify their data if we see something that looks like a potential data entry or calculation error. We may also ask for additional clarification about data entered into key data fields or notes that may be unexpected. We also often request more information about delivery systems or populations included in specific measures. Finally, we typically ask a question if we notice large changes in the state's rates or denominators from what the state reported the previous year, or if the state uses a different methodology to report the measures. Please note, if you receive any questions from us during the SMI process, it does not mean that your state did anything wrong. We typically ask clarifying questions to every state about some aspect of their core set reporting. The SMI process helps us to gain a more comprehensive understanding of the nuances in each state's data. This process can also help to increase the number of measures reported, as some states are able to report more measures with additional time or technical assistance. Once again, we'd like to thank all the states for their timely and informative feedback that they provide during this process. For FFY 2019, CMCS will have a similar focus on data quality. This slide contains some of the high-level things we look for, but if you would like any more detail about these issues, please refer to the appendix at the end of the slide deck. You should be able to refer to this once the slides are sent out after the training. Here are some ways we can address the most common data quality issues in MacPro. As you enter data into MacPro, you may notice that the system contains built-in data quality checks to help ensure the data are complete and accurate. States can refer to the data quality checklist, which is linked in the appendix of this presentation, to see the list of checks that are implemented in MacPro. These error flags will often show up in red when you try to save a message or when you try to validate the measure. They may not appear right away, but if you notice you are having trouble saving or validating a measure, you may need to scroll up to look for these flags, and they'll often show up as a red box around the data entered. Reviewing the flags during data entry will help improve the quality of data and also help facilitate the process of certifying the report in MacPro. As in previous years, CMCS plans to conduct outreach using the SMI function in MacPro. On this slide, we listed some of the areas CMCS will be focusing on during the data quality process for this year. These include looking for consistency of reporting on measures calculated using the hybrid method, meaning ensuring there is complete information on the sample size, denominator, and measure-eligible population. We will also focus on calculation and reporting of state-level rates when data are combined from multiple reporting units, such as health plans or programs. We will look for documentation of populations excluded from the data, for example, if certain state delivery systems, programs, special populations, or certain healthcare settings are excluded. The more information you can provide when reporting, the more helpful that will be when we review the data. We look for documentation of any deviations from core set specifications, including use of different age groups, data sources, or methods, knowing whether measures were audited or validated, and finally ensuring alignment between core sets when measures are reported for multiple core sets. Next, we're going to review some of the technical assistance resources developed for FFY 2019 child and adult core set reporting. And the slide after this will talk about health home core set reporting. The first resource are the measure lists. These list all the measures included in the specified core set, as well as their NQF number if applicable, measure steward, full measure name, data collection method, and contextual notes. Next, the resource manual and technical specifications begin with an introduction to the core set and general guidance on some cross-cutting topics related to data collection and reporting. The remainder of this document includes step-by-step measure specifications for each of the measures included in that core set, as well as some specific guidance for each measure. The next document is a summary of updates to the resource manual and technical specifications, which includes a summary of all changes to the specifications, including any new guidance to reporting that was added. The next document is the data quality checklist, which includes data checks aimed to improve the accuracy, consistency, and documentation of the data reported in MacPro. This checklist contains guidance on how to complete some of the cross-cutting fields in MacPro, as well as measure-specific quality checks. As we discussed previously, many of these validation checks have been built into MacPro, so this document would be really helpful to keep handy when you're entering the data. Next, the measurement period table outlines the appropriate measurement periods for each measure specification. CMCS encourages states to enter the denominator start and end date according to this document, as long as the state follows the core set measure specifications. Additionally, there are a few technical assistance briefs that may be helpful. First, the hybrid method brief provides an overview of the hybrid method and gives considerations for using this method. Second, the state-level rates brief is helpful for states that combine data from multiple programs or managed care organizations. This brief also includes information on how to combine data when programs use different methodologies for collecting data. For example, one uses admin and another uses hybrid. And as Christy mentioned previously, we also recently developed a fact sheet on the plan all-cause readmissions measure. We will send a communication soon on where you can access this fact sheet on Medicaid.gov. Several core set measures also have sample SAS code that has been developed. The SAS code can be obtained by emailing the technical assistance mailbox. Finally, there are a couple of technical assistance webinars that states may find helpful in reporting the core set measures. First, the FFY 2019 Updates and Reporting Resources webinar discusses the major updates to the FFY 2019 core set. Second, the Collecting and Using Stratified Data for Quality Improvement in Medicaid and CHIP webinar provides information on how to collect and use stratified core set data for quality improvement, highlights states' experiences, discusses how to report stratified data in MacPro, and prevents technical assistance resources. Hyperlinks to these resources are included in Appendix A. Next, we're going to review some of the technical assistance resources developed for FFY 2019 Health Home core set reporting. As you'll see, the Health Home core set also has a 2019 measure list, resource manual and technical specifications, summary of updates document, data quality checklist, and measurement period table. These resources are very similar to those we discussed in the previous slide, so I won't discuss them in detail here. There are, however, a couple of resources that are unique to the Health Home core set. First, the Health Home Expected Reporting Table provides a list of states by SPA that are required to report from FFY 2018 to 2020. Second, the Technical Assistance webinar on state reporting of Health Home core set measures, status of FFY 2015 to 2018 reporting, and updates for FFY 2019 discusses updates to measure specifications in more detail. Hyperlinks to these resources are also included in Appendix A. There are two important email addresses to keep in mind when reporting your core set data. The first is the Technical Assistance mailbox, macqualityta@cms.hhs.gov. You can use this mailbox when you have questions about calculating, reporting, or using the core set measures. We are happy to answer any questions you have or set up a telephone call to discuss your questions. The second mailbox is macpro_helpdesk@cms.hhs.gov. This is the appropriate mailbox to contact when you have questions about MacPro, its functionality, or accessing the system.
The MacPro Help Desk team welcomes your suggestions for our training and reference materials. Please contact us with your feedback and comments on this training, or if you need other MacPro assistance. You may contact us via email at macpro_helpdesk@cms.hhs.gov or by phone at 301-547-4688.